Hello. Assalamu alaikum. We are actually repeating our previous session abnormalities of WBC count. WBC have a precise well control of their normal count because of its various aspect when it is originated from. WBC are they have a precise count like it is maintained by progenitor cells like it's 4,000 to 11,000 per cubic millimeter, from which the neutrophils have a 55 to 65 count. Percentage eosinophil is 1 to 4, basophil is from 0 to 1, lymphocytes are from 20 to 40, monocytes are from 3 to 8% only. This count is a normal count. It's been regulated by a certain stimulating and inhibiting factor. So we have a certain stimulating factor which do regulate the production of a WBC. From which one of its the main powerful is a cytokine called cytokine that stimulate the proliferation and differentiation of the WBC. Another one is called colony stimulating factor, colony forming stimulating factors. Other one is also a colon linkage specific factor. These are all for the WBC. Another for the RBC is the erythropoietin. And for the granulocytes, monocyte are the granulocyte, monocyte, colony stimulating factor. Another one is a TPO. Another one is a TPO. It is a thromboplastin factor. Other cytokines such as interleukinins support the development of the lymphocyte and act synergistically to aid the function of the WBC and its a normal number. Further, lymphoid tissue present the structure where lymphoid originate. There are the two main sites from where lymphoid tissue can be originated. One are the bone marrow, others are the thymus. These are the main central sites for the production of the lymphocytes. The other are the not the central, but they are on the periphery. These are peripheral sites for the production of the lymphoid tissue are lymph nodes, spleen, mucosa-associated lymphoid tissue, cutaneous immune system. In addition, poorly defined granulocyte, lymphocyte, these are on a main tissue. Okay, so these I discussed now that these all do have a production, do have a main role in the production of the WBC. But this control may be disrupted when there is an abnormality or when there is some sort of the misbehaving of its production or its use. So the count of the WBC could be increased above the normal or it could be decreased below the normal. When it is so we could say that these are the various disorders of the WBC that count on this is that when the number of leukocytes or WBC in a peripheral circulation could go higher or lower. When they go lower than the normal count, it is described as a leukemia. When the absolute number decreases than the normal, from what is the normal count? From the 4,000 to 10,000 microliters. When this number become lower than this number, when the WBC become lower, so it is called a leukopenia. Concerned with the particular leukocyte, like when the number of neutrophils are decreased, they are known as a neutropenia. Likewise, the lymphopenia, for the when the number of the lymphocytes are going to be decreased. On the contrary, when there is an increased number of the WBC, so we could call them a leukocytosis. Leukocytosis. The term leukocytosis describes the absolute increase in WBC, like they could be increased the neutrophil, eosinophil, basophil, lymphocyte, and monocyte. So they are going to be called like a neutrophilia, eosinophilia, basophilia, lymphocytosis, and monocytosis. Like when there is an increased number, it is called the leukocytosis. The concerned number is like a neutrophilia, eosinophilia, basophilia. This is the increased number. While decreased number of the WBC called concerned with the particular cell are the neutropenia or the lymphopenia. Why these count could be altered? They could be altered when there is number one, when there is a defect in a progenitor cell or from where they are produced, bone marrow, or, or bone marrow or the thymus or the lymph node. Either they are defective or there is some sort of the abnormality or other systemic disease that could alter the size of the WBC. So we are going to discuss them properly. When there is a decreased number of the neutrophils, we are calling them neutropenia. Neutropenia is a condition when the neutrophils are going to be decreased less than 1500. There is a condition called agranulocytosis in which the neutrophils have a count less than 200. This condition of the decreased number of the neutrophils could be acquired or could be congenital. Congenital is a one condition or a one syndrome. You must remember that it is a Costman's syndrome. Costman syndrome is occur due to with the newborn, or we could say that it is a congenital. The defect it is a autosomal recessive disorder that the neutrophil count is decreased with the birth, in which total number of the neutrophils are going to be decreased. Acquired neutropenia means a decreased number of the neutrophil could be due to when there is a inflammation or the infection, like infection from the virus, bacterial infection, there is a decreased count of the neutrophils. Likewise, for example, if we are having a bacterial flu, so we could have a decreased number of the neutrophils due to by the fighting of the with the infectory virus or the bacteria. Their numbers could be decreased, or there could be other problem could be in their destruction would be higher than the normal. the destruction could be due to drug induced. When we are doing the chemotherapy or when we are giving the alkylating agents for the malignant cell, the normal cells of the body are also going to be affected. So the affecting of the neutrophil. So this is a acquired condition in which neutrophils are going to be decreased. Others are the autoimmune disorders, and others are is when there is a production site has been altered, like there is a huge or increased size of the spleen. We could say that the splenomegaly, that in which there is an increased number of the neutrophils are going to be dead into this abnormal organ of the spleen. And another one is the Felty syndrome. This is rare, but it could be a variant uh, condition in which there is a rheumatoid arthritis and with the huge destruction of the neutrophil. And also the malignant conditions of the bone marrow in which neoplasm or the neoplasm of the bone marrow in which neutrophils are affected. So we discussed that neutrophils decrease count or the neutropenia could be congenital by a Cotman syndrome. It could be acquired by a certain condition. One is inflammation, infection, drug-related autoimmune disorder, and a Felty syndrome. So you must remember what are the conditions. They are going to be increased above the normal or decreased uh, from the normal. Acute neutropenia could be also with a certain condition that the alcoholism or the too much intake of the alcohol or a deficient state of the folic acid, vitamin B12, iron, copper. What are these? These are the nutrient factor, the like a folic acid, vitamin B12, iron, copper. These are all are a nutrient factor which could help their nutrition of the WBC. So when these factor must be deficient, they would affect the production of the neutrophil certainly. Other is aplastic anemia. In aplastic anemia, all of the myeloid stem cell are affected, not only RBC but also WBC, resulting from the anemia in a thrombocytopenia and a granulocytosis. At the last, the idiopathic neutropenia that occurs in the absence of other disease or provoked and influence. The word idiopathic we are using when we cannot find any particular cause. So there is also a decreased number of the neutrophil when we cannot find the cause. So we could label them as a idiopathic neutropenia. On the other hand, there could be their increased count above the normal. When there is an increased count of the neutrophil, we would label them as a neutrophilia. Neutrophilia could be like in a newborn, in a pregnancy, in a labor, or a postpartum, or after exercise. These are all under the heading of the physiological causes of the neutropenia. Please mind it, this is a normally condition in a certain when the requirement of the neutrophils become higher than the normal. So when somebody is asking you or there is a BCQ, what are the physiological causes of increasing neutrophil? These are the in could be the newborn, pregnancy, in a labor, or after the labor, or during the state of the exercise, or there could be these all are the physiological causes. But the drugs or toxins, these could be related with some sort of the insult to the body, like administration of the corticosteroid may increase the neutrophil above the normal. It's not a good that a neutrophils would remain in a body above the normal. So, taking of the corticosteroid or certain creams like betanoate when the people are using, there could cause the neutrophils count would be remain in a body above in the normal. Acute poisoning from the mercury, poisoning from pluralism, and this could be the reason of the poison. Reactive neutrophilia would be from a certain malignant condition like leukemia reaction and other certain some sort of disease. The metabolic causes of the increased number of neutrophils due to diabetes, ketoacidosis, renal failure, and in gout. And there are um, certain malignant disorder or the disease in which we are having these various markers of the malignancy, CGL, MPC, these are certain markers of the malignant disease in which there is an increased count of the WBC. Eosinophils are going to be increased like in allergic condition. Person suffering from asthma or allergy, when we are taking the sample of the blood, we are taking, then it is said to be like it is said there is a increase. When we see the increased number of the eosinophil, we could consider or suspect asthma in a patient or a acute allergic reaction like asthma, atopic dermatitis, parasitic infection, fungal infection, or a TB or a tuberculosis. These are the various conditions in which eosinophils are going to be above the normal one. Also, like neutrophils, eosinophils are again going to be rise in a certain malignancy. With the also there is a drug aspirin, beta blockers, penicillin, cephalosporin, non-steroidal anti-inflammatory drugs like brufen. They are also become the reason of the increased count of the eosinophil. There is also idiopathic or unknown cause of the increasing number of the eosinophil also. Certainly, bacterial infection does not cause so much increase like a neutrophil, but there is also increasing in eosinophil during infection. Lymphocytosis, increased number of the WBC. This could be viral, it could be bacterial, but the most of it, the lymphocyte increasing numbers are in a glandular fever, hepatitis, cytomegalovirus, or a viral infection, other infectious tissue, protozoal infection, chronic intracellular bacterial infection, chronic lymphoid leukemia. These are the certain conditions you are not going to be asked in a very much detail, but saying to be the like a certain viral infection, protozoal infection, and a bacterial infection certainly could increase the lymphocyte count. Relative lymphocytosis means not so much increase, but there is also increase, little bit amount of increasing in number is when the age is less than 2 years, or acute viral infection, connective tissue disorder, thyrotoxicosis, or increased number of insulin during exercise or stress. But the concern over here, or it is to be always counted increased number of the leukocytosis. That is certainly giving us a clue of certain viral disease or protozoal or bacterial diseases. One of a condition is infectious mononucleosis. Infectious mononucleosis is this picture of the lymphocyte in which there is a condition of the infectious mononucleosis in which the lymphocytes are going to be increased. It is condition in which there is a viral infection. Virus is known as Epstein-Barr virus. Epstein-Barr virus. It is a DNA type of the virus. Patient representative adenopathy or increased size of the adrenal glands, hepatomegaly, splenomegaly, fever, malaise, pharyngitis, also a characteristic signs of the infectious mononucleosis. Monocytosis, increased number of the monocyte. These are again due to certain infection like tuberculosis, brucellosis, like that. Blood immune causes are a myeloproliferative disorder. This is a pathological condition or blood disorder in which monocytes are going to be increased. Also, there is a autoimmune diseases in also there is an increasing number. Malignancies are the Hodgkin's lymphoma. Monocytes are increased in a certain side of the lymphoma. In the leukemia, one are known as Hodgkin's, other are known as non-Hodgkin's, in which there is an increased number of the monocytes. Monocytopenia, decreased number. Decreased number is also in infection, stress, anemia, in myeloid leukemia, and also certain drugs like myelotoxic drugs, and treatment of the corticosteroid like glucocorticosteroid, and which monocytes are going to be decreased. Basophilia could be due to the increased size of the RBC, WBC. I've been a little quick way because we are only having a 40-minute lecture. After then that, it is going to be up. So that's I've been running a little speedy. And also basophils are also like having an abnormal number due to a certain abscesses, neoplasm, allergic reaction, hereditary, and like that. But it's not so much important. Neoplastic disorder, in which neoplastic disorder of the hematopoietic lymphoid origin, in which certain some of these are the leukemia, lymphoma, certain multiple myeloma, in which all the WBC are going to be altered. Certainly there is a increasing disorder. So these are the certain type of the lymphoma that could be that could occur there, like leukemia or a malignant neoplasm that could cause the lymphocytic. They could be having origins like lymphocytic myelogenitor like cell. So these are also, you are not going to be asked by certain detail of the leukemias. They are going to be asked in pathology. But you are concerned with the increasing side, in which condition WBC are going to be increased or decreased. These are various images of the acute myeloid lymphoma, acute lymphoid leukemia, and like that. So, so thank you very much. Have a good day. I hope that if there are any questions, you are welcome to ask. Thank you. Goodbye.